By the end of this video, you will understand why insulin is the real root cause. So when your reports say normal, it does not always mean you are healthy. You can look thin but still be metabolically unhealthy. Still struggle with belly fat, PCOS, fatty liver, high cholesterol. This is called toffee. Thin outside, fat inside. And this is very common in Indians. Insulin resistance begins 10 to 15 years before blood sugar rises. Your blood sugar is normal. Your HbA1c is within range. But still you are gaining weight, feeling tired, struggling with PCOS, infertility, or cholesterol issues. So what is going wrong? The problem is not sugar. The problem starts much earlier with insulin. And today I am going to show you why insulin has suddenly become the most important conversation in modern health. Hi, I am Dr. Hitesh Chaudhari, International Ayurveda Consultant and Celebrity Health Expert. And in this video, we will decode one of the biggest hidden drivers of modern diseases, hyperinsulinemia. By the end of this video, you will understand why insulin is the real root cause, why your reports may still look normal, and how Ayurveda had already explained this thousands of years ago. Most people believe diabetes starts when blood sugar increases, but research shows something very different. Insulin resistance begins 10 to 15 years before blood sugar rises. During this phase, your pancreas produces more and more insulin just to keep your glucose levels normal. So when your reports say normal, it does not always mean you are healthy. It often means your body is overcompensating. And this is where the real problem begins. Let me tell you something very important. Blood sugar is a late marker. Insulin is an early marker. By the time HbA1c increases, metabolic damage has already started. And that's why many people with normal sugar, normal HbA1c still struggle with belly fat, PCOS, fatty liver, high cholesterol. Because insulin has been high for years silently. There is another concept, and which is very important, supported by multiple studies. You can look thin but still be metabolically unhealthy. This is called toffee. Thin outside, fat inside. And this is very common in Indians. Research shows that South Asians tend to store more visceral fat, develop insulin resistance earlier, face metabolic diseases at lower BMI. So even if your weight looks normal, your metabolism may not be normal. And this is why insulin is now getting so much attention. If we go back in history, 100 years ago, people ate 2 to 3 meals and no processed food at all and high physical activity. Let's talk about 300 years ago. Seasonal eating was there, natural fasting was there, and no refined sugar at all. And 1000 years ago, if we see, food was simple, lifestyle was very active, and metabolism was stable. Now look at today. Eating every 2 to 3 hours, high refined carbs are there, and sugar, sedentary lifestyle is there, chronic stress, and poor sleep. So all of this leads to one thing, that is constantly elevated insulin. Even stress alone has been shown in studies to increase insulin resistance. So this is not just about diet, this is about lifestyle mismatch. Before lab test detect anything, your body gives signals. If you observe carefully, you will notice increasing belly fat, darkening of skin around the neck or underarms, skin tags, constant hunger or sugar cravings, fatigue after meals, difficulty losing weight, PCOS or irregular cycles. These are not small issues. These are early signs of insulin resistance. And if you want clarity through investigation, focus on fasting insulin, HOMA-IR, triglyceride to HDL ratio, trends in fasting glucose, because waiting for HbA1c alone means you are already late. And if you look at this through Ayurveda, this condition is not new. It can be understood as Kapha dosha aggravation, Meda dhatu dushti, Agni impairment, and Ama accumulation, leading to conditions like Prameha, Sthaulya, Vandyatva. Ayurveda always focused on early imbalance and not just disease. What we call insulin resistance today, Ayurveda was already managing at the root level. The solution is not just medication, it is metabolic correction. Modern approach says reduce your meal frequency, avoid refined carbs and sugar, strength training and walking, sleep optimization, stress management, and at the same time what Ayurveda says is Deepana and Pachana to improve Agni. You should correct Meda Dhatu. Herbs like Gudmar, Vijayasar Triphala will help to increase insulin sensitivity. Wherever required, Panchakarma you can do with the professional guidance and a personalized diet based on your Prakriti. The goal is simple: lower insulin, restore metabolism, prevent disease before it begins. If this gave you a new perspective on your health, make sure to like, share, and subscribe to this channel. And I also conduct free webinars called The Health Secrets, where I go deeper into metabolic disorders and their root causes. So the link is in the description. Let's not wait for the disease. Let's understand the body early.